9 early warning signs of nasopharyngeal cancer. You should never ignore. The nasopharynx is the upper part of the throat, also known as the nasal pharynx, located behind the nose and above the back of the mouth. When cancer cells develop and form a malignant tumor in the nasopharynx, they can not only affect the respiratory system, but also spread to other parts of the body. Nasopharyngeal cancer is a serious disease. However, when detected early, the chances of successful treatment are significantly higher. To protect your health and the well-being of your family, pay close attention to the following warning signs. Each of these symptoms may seem mild at first, but they could be your body's way of alerting you to a potential problem. Do not ignore them if you notice any of the following. Number 1. A persistent cough without an obvious cause. A persistent cough, especially one that is not related to a cold or the flu, may be a serious warning sign. You may experience a dry, irritated, or itchy throat that causes frequent coughing. The cough may produce mucus and, in some cases, even blood. If your cough lasts for more than 2 weeks without improving, it should not be ignored. Many people mistake this for a common sore throat and simply wait for it to go away. However, if your cough persists for no apparent reason, you should see a doctor for a thorough evaluation. Number 2. Persistent sore throat and coughing up blood. A tumor developing behind the nasopharynx or within the nasopharyngeal cavity can cause a persistent sore throat and difficulty swallowing. In its early stages, this symptom is often mistaken for chronic pharyngitis because the symptoms are very similar. However, a sore throat caused by nasopharyngeal cancer usually lasts much longer and does not respond to conventional treatments. Coughing up blood is more common in advanced stages of nasopharyngeal cancer. As the tumor grows, it can invade nearby tissues, causing tissue damage and ruptured blood vessels that lead to bleeding. Among the possible causes of blood-streaked mucus, both nasopharyngeal cancer and lung cancer are particularly serious conditions that require immediate medical attention. Number 3. Hoarseness or changes in your voice. If your voice suddenly becomes hoarse for no apparent reason, even though you haven't had a cold or strained your voice, it could be a warning sign. Hoarseness that lasts longer than a week or occurs repeatedly should not be ignored. This may happen when the vocal cords are affected or when there are structural changes in the throat. You may notice that your voice sounds heavier or that it becomes difficult to speak clearly. If you experience any unusual changes in your voice, schedule a medical examination as soon as possible. If you find this information helpful, please like this video, subscribe to our channel, and turn on notifications so you never miss our latest health updates. Number 4. Persistent ear pain. Without an obvious cause. One subtle but potentially dangerous symptom is recurring ear pain with no clear explanation. This type of pain is usually unrelated to an ear infection or other common ear conditions. You may experience pain in one ear or even both ears. The discomfort is often accompanied by a sore throat or jaw pain. If you've been experiencing persistent ear pain, consult an ear, nose, and throat specialist. A professional evaluation can help rule out the possibility of nasopharyngeal cancer. Number 5. Swollen lymph nodes in the neck. Swollen lymph nodes in the neck are one of the most common early signs of nasopharyngeal cancer. You may notice one or more small lumps in your neck that feel either soft or firm. These swollen nodes are usually painless but do not disappear over time. The swelling may also create a feeling of pressure or discomfort in the neck. Don't assume it's simply a minor infection. Seeing a doctor is the best way to determine the exact cause. Number 6. Persistent nasal congestion. A blocked nose isn't always caused by a cold or allergies. In some cases, it can be an early warning sign of nasopharyngeal cancer. You may notice that one nostril remains persistently blocked for no obvious reason, and the congestion does not improve even after using nasal decongestants. Sometimes, you may also notice blood in your nasal discharge when blowing your nose. Number 7. Frequent headaches. Persistent headaches, especially around the forehead or temples, can also be an important warning sign. The pain may be dull or severe without any obvious cause. These headaches may be accompanied by fatigue, dizziness, or even changes in vision. If your headaches continue despite rest or pain medication, don't ignore them, especially if you have no previous history of chronic headaches or related medical conditions. Number 8. Unexplained weight loss. Sudden weight loss without changes to your diet or exercise routine is another symptom that deserves attention. You may notice that you're becoming thinner without understanding why. Unexplained weight loss is often accompanied by fatigue and a general decline in overall health. This may indicate that your body is dealing with a serious underlying condition, including cancer. Pay attention to unexpected changes in your weight and discuss them with your healthcare provider if you're concerned. Number 9. Persistent fatigue. Do you constantly feel exhausted, even when you haven't done any strenuous physical activity? Ongoing fatigue can make it difficult to concentrate and complete your daily tasks. Even after getting a full night's sleep, you may still feel drained throughout the day. This symptom may occur alongside other warning signs such as a persistent cough, sore throat, or unexplained weight loss. Don't dismiss long-lasting fatigue, as it could be your body's way of signaling a serious health issue. In conclusion, nasopharyngeal cancer is a serious disease, but recognizing its early warning signs can greatly improve the chances of successful treatment. If you notice any of the symptoms discussed in this video, don't delay, seek medical attention as soon as possible. Always listen to your body and make your health a priority. Taking care of yourself is not only a responsibility to yourself, but also a way of showing love and care for your family. Thank you so much for watching today's video all the way through. Please leave a like and share your thoughts in the comments to help more people discover this important health information. And don't forget to subscribe to our channel for more valuable health tips and educational videos. As always, Healthy Lifestyle Podcast channel wishes you good health, a long life, prosperity, and lasting happiness.